Good morning to you, MEC. So you've removed an entire team from this particular hospital. Just how bad was the situation at Tshilidzini?
I think Tshilidzini Hospital, being our regional hospital in the entire Vembe district, providing services not just to the communities around, but also to all the level 1 district hospitals referring to them. We have been, it's an open secret that we've been inundated with serious challenges. I've been there on a New Year's Day where indeed I've seen for myself how bad the situation is, and there was a time wherein I ended up having to work to support and assist the doctors who were working in that casualty. And following that, I tried to sit down with management to show them how we can best manage our queues and our casualty, how things should be done. We are not disputing the fact that there are challenges which are not of their own making, for instance, infrastructure, when you look at that casualty there. But those problems are not unique to Tshilidzini. We do acknowledge that in certain categories, especially the lower categories of workers, we do have shortages, but it's not unique to Tshilidzini. But there are areas which we believe that until we put up the proper leadership of the hospital that can have the vision and that can inspire workers to be able to appreciate the fact that given the limited resources that we are currently having as a department, we can still do much in terms of a proper and quality service delivery. So the situation, yes, I can indicate to you, it was bad. We assist them from my office to even recruit medical specialists, because as a regional hospital, it's supposed to function like one, but they are not even staying. They can't even inspire them to be able to retain them. Even when we request specialists from other provinces to come from the private sector to assist with clearing the backlog of patients who need surgery, because it's a rural area, we don't have specialists there. They are not able to even assist. They will switch off their phones and they will say they are not available as management. And sometimes consumable must be ordered from my office. I mean, it's things that really warrant the local management. I met with the different categories of workers. I've met with the nurses there and listened to their issues. And issues that they were raising mainly are issues of local management. If you can't order a linen and buy linen for your staff, you don't expect the MEC to come and buy linen for the staff there, for staff to be able to render services.
Okay, MEC, I don't mean to interrupt you, but we are running out of time. I just want to get this question in. So with the entire management team now fired, who is now in charge at Tshilidzini Hospital? Who's running it?
We are putting an interim leadership. We left the district manager there to be looking after the whole hospital between now. We are going back on Tuesday. On Tuesday, I'm going to bring an intervention team. The intervention team that we will bring on Tuesday to Tshilidzini will comprise of the acting CEO, the acting clinical manager, somebody who will also be acting as a nurse manager. We're also looking at human resources, also the finance manager, because those are the 4 areas which really are key towards running of the hospital. So on Thursday, the interim team that we are going to be putting there on Tuesday, it will be given 100 days like we do in other facilities, and they will have terms of reference. All what we want from them is to put systems, because the hospital does not have systems to function. That is why we are finding ourselves wanting that patients will send me pictures that they've been there from 8 o'clock in the evening, 20 hours, until 2 a.m. when we are struggling to get them to be seen in casualty. So equipment that get broken and don't get fixed. Some of the issues really warrant local management. So that interim team, it will be given 100 days. And within 100 days, we'll be going back, monitoring, supporting the team. And when systems are properly in place, we will be able to take the matter forward from that angle.
All right. Dr. Popila Matuba, the Limpopo Health MEC, thank you so much for your time this morning. And we will continue to watch all the developments coming out of Tshilidzini Hospital.